Hello, my name is Cassie Baker, and I'm a student at Eastern Kentucky University seeking my master's in nursing degree with hopes of becoming a family nurse practitioner. I have followed the steps set out by the Johns Hopkins Nursing Evidence-Based Practice Model to propose an evidence-based project to tackle the problem of weight loss in obese adults, and would like the pleasure of sharing it with you. In the United States, obesity is a significant healthcare issue. The Center for Disease Control defines obesity as a body mass index of 30 kilograms per meter squared. According to data from the National Health and Nutrition Survey, the prevalence of adult obesity in 2009 to 2010 was 35.5% in men and 35.8% in women. Also, obesity is associated with increased rates of heart disease, stroke, type 2 diabetes, and certain types of cancer. In reaction to the high rates of obesity, Healthy People 2020 set forth a goal to reduce the number of adults that are obese. The purpose of my proposed project is to provide an evidence-based intervention that will assist obese adults in meeting a weight target loss of 5%. I reviewed an article by Turkowski and found that weight loss of 5% can reduce the risk of stroke, heart attack, and diabetes, while also decreasing blood pressure, cholesterol, and inflammation. Weight counseling has in the past been the conventional method of addressing obesity, but in a qualitative study by Woodruff and colleagues, it was discovered that clinicians often found it ineffective due to inefficient time, competing patient concerns, and an absence of community resources. As a result, evidence-based interventions are needed, and the obese population and their providers, including those advanced practice nurses, are ready for these changes. While following the Johns Hopkins model, I completed a focused literature review and selected a body of evidence that included randomized controlled trials conducted in the community with adults. Multiple studies demonstrated that lifestyle interventions that emphasized diet, behavior, physical activity, and self-monitoring and utilized group sessions were effective in decreasing weight. Maintenance of the weight loss was also demonstrated in these interventions. The interventions included collaboration of interdisciplinary teams, including some combination of nurses, doctors, exercise specialists, lifestyle coaches, behavior specialists, occupational therapists, or dietitians. Through reviewing these studies, I noted several items of value for nursing practice. First, multiple interventions are necessary for weight loss to occur. Second, lifestyle change is a cooperative venture. For example, group sessions and professional feedback were more helpful when they were coupled with self-monitoring. Lastly, although the weight loss changes were found to be significant in the intervention groups in the reviewed studies, they were still only small changes made over extended periods of time. Changes may happen slowly, but they should still be encouraged and celebrated. Findings of these studies can be put into practice through encouraging self-monitoring in combination with group sessions, incorporating dietary and exercise advice into practice, providing regular feedback, and collaborating with other professionals. All of these items are included in my proposed project, which I will now share with you. After being recruited from a local primary care office, participants in the project will participate in large group sessions, small group meetings, and use logbooks to monitor dietary and physical activity. The large group sessions will meet at a local community center. An advanced practice nurse and either a dietitian, exercise specialist, behavior specialist will conduct the sessions. Each month will focus on a specific emphasis, for example, diet or exercise. New exercise, managing dietary intake, incorporating physical activity into personal lifestyles, and identifying personal barriers to weight loss will be areas of focus. Small group meetings will meet twice per month, and they will be separate from the big group sessions. Groups will consist of 4 to 8 individuals. Small group meetings can be done at any time, and they can be utilized to go do an activity or to talk about barriers or special celebrations or goals that the participants have. Utilization of a logbook will encourage participants to be mindful of dietary intake and physical activity throughout the day. Logbooks will be provided to participants by the project. Participants will write down daily dietary intake and physical activity. Monthly review of the logbooks at the large group sessions will be a time of celebration and encouragement for their success. The The objects of the project are to first create a sustainable, community-centered weight loss program. Second, to assist obese and overweight adults in losing greater than 5% of body weight within 6 months, and maintain this loss for an additional 6 months. And lastly, create encouraging relationships between participants that increase accountability outside of the group sessions. The target outcome of the project is ultimately weight loss. To evaluate the effectiveness of the project, weight in kilograms will be recorded at each monthly session. Comparison will be made to baseline at weight of 3, 6, 9, and 12 months to determine the percentage of weight loss. The goal of the intervention is for participants to have a weight loss of greater than 5% from baseline at 6 months and to have maintained or surpassed this loss at 12 months. With more than 1/3 of Americans being obese, advanced practice nurses and other healthcare professionals are seeking evidence-based interventions for this problem, and their patients are ready for a solution. By conducting a focused literature search and critically evaluating a body of evidence, I found evidence that demonstrated that lifestyle interventions that include multiple healthcare specialties, group dynamics, and self-monitoring are effective in achieving weight loss in obese adults. By applying this evidence to nursing practice, I've developed and proposed an evidence-based practice project that incorporates self-monitoring, group sessions, and support systems, and access to specialists with the goal of achieving weight loss through changing lifestyles. Thank you.